Assalamu alaikum wa rahmatullahi wa barakatuhu. Students, in our last economics class, we have started with chapter number 5, that is human capital formation in India. Okay, so under that we have discussed introduction, then what is human capital, then sources of human capital, and human capital and economic growth. Okay, so today inshallah we will move on to the next topic, that is human capital and human development. Okay, so this two term, that is human capital and human development, it sounds similar, but there is a clear differences between them. Okay, so there is a clear distinction between them. Human capital considers education and health as a mean to increase labor productivity. Okay, human capital considers education and health as a mean, okay, to increase labor's productivity. Whereas human development is based on the idea that education and health are the integral part to human well-being, because only when people have the ability to read and write and the ability to lead a long healthy life, they will be able to make other choices which they value. Okay, so human capital treats human being as a mean to an end. Okay, human capital treats human being as a mean to an end, the end being the increase in productivity. Okay, in this view, any investment in education and health is unproductive if it does not enhance the product output of the goods and services. But whereas in the human development perspective, human beings are end in themselves. Okay, so human welfare should be increased through investment in education and health, even if such investment do not result in higher labor productivity. So therefore, basic education and basic health are important in themselves, okay, irrespective of their contribution to labor productivity. So in such a view, every individual has a right to get a basic education and basic health care. That is, every individual has a right to be literate and has a right to lead a healthy life. Okay, so this is the basic difference between human capital and human development. So human capital is a narrow concept, whereas human development is a broad concept. Okay, human capital states that education and health as a mean to increase labor productivity, whereas human development states that education and health is the integral part of human well-being, because only when a person has the ability to read and write, he will be able to lead a healthy life. Okay, then the third difference is it treats human being as a mean. Okay, the human capital treats human being as a mean to an end, the end being the increase in productivity, whereas human development treats human development as an end in themselves. Okay, and the last difference is human capital considers that investment in education and health is unproductive if it does not increase the output of goods and services, whereas human development considers that human welfare should be increased through investment in education and health, if such investment do not result in higher labor productivity. Okay, even though the education and health does not result in higher productivity, but human welfare should be increased with the help of education and health. Okay, I hope this much is clear. Next we will move on to the next topic, that is state of human capital formation in India. Okay, human capital formation in India. See, we have already learned that human capital formation is the outcome of investment in education, health, on-job training, migration and information. Okay, so out of this, education and health are very important source of human capital formation. Okay, see, we all know that ours is federal country with a union government, state government and local government. Okay, so the constitution of India mentions the functions to be carried out by each level of government. So accordingly, the expenditure on both this education and health are to be carried out simultaneously by all the three tiers of the government. That is the, as I've told you, union government, state government and local government. Okay, so this education or the expenditure on education has to be carried by three tiers of the government. Okay, so in this chapter you will be studying only about education. Okay, because the health sector will be taken in chapter number 8. Okay, now do you know how much does a government spend on education and health? See, the education and healthcare services creates both this private and social benefit, and this is the reason for the existence of both private and public institution in the education and health in the market. Okay, so I have told you the education and healthcare services is important for both. It is important for private and social. Okay, so it creates benefit for both private and social. Okay, it creates benefit for it creates social benefit as well as private benefit. That is the reason why both this private and public institution exist in the market. Okay, so expenditure on education and health makes substantially long-term impact and they cannot be easily reverted. Okay, so hence the government intervention is essential. See, for example, if once a child is admitted to a school or healthcare center where the required services are not provided, so before the decision is taken to shift the child to the another institution, substantial amount of damage would have been done. Okay, so moreover, individual consumer of this service do not have complete information about the quality of the services and their cost. Okay, so in this situation, the providers of education and health service acquires monopoly power and are involved in exploitation. So the role of government in this situation is to ensure that to provide or the role of government is to the role of government in this situation is to ensure that the private providers of the services adheres to the standards stipulated by the government and charge the correct price. Okay, so this is the role of government in this situation. Okay, so the role of government in this situation is to ensure that the private providers of the services charge the correct price and provide the proper services. Okay, so in India, the ministers of education, that is the ministries of education at the union and state level department, state level is the Department of Education and various organizations like NCO, that is not NCO, that is NCERT, that is National Council of Education Research and Training, then University Grant Commission UGC, and All India Council of Technical Education. Okay, that is AICTC. Okay, this facilitates institution which comes under the education sector. So similarly, the Ministry of Health at the union and state level, Department of Health and various organizations like Indian Council for Medical Research, that is ICMR. Okay, this facilitate institutions which comes under the health sector. Okay, so in the developing countries like ours, that is India, with a large section of population where people is living below the poverty line, many of us cannot afford many of them cannot afford the basic education and healthcare facilities. Okay, and a substantial section of our people cannot afford to reach super specialty healthcare and higher education. So when we consider this basic education and healthcare is see, when we consider this basic education and healthcare as a right of the citizen, it is essential that the government should provide education and health service free of cost to its deserving citizens. Okay, so both union and state government have been stepping up expenditures in the education sector over the years in order to fulfill the objectives of attaining cent% literacy and also considerably increase the average education attainment of the Indians. Okay, I hope this much is clear. Next, we'll be talking about education sector in India. Okay, that is the growth in government expenditure on education. Okay, growth in government expenditure on education. So do you know how much does the government spend on education? So this expenditure by the government is expressed in two ways. Okay, the expenditure of the government on education is expressed in two ways. So the first is as a percentage of total government expenditure, and second is as a percentage of gross domestic product. Okay, that is GDP. Now, what is the percentage of education expenditure of total government expenditure? Okay, so the percentage of education expenditure of total government expenditure indicates the importance of education in the scheme of things before the government. Okay, and the percentage of education expenditure of GDP expresses how much of our income is being committed to the development of education in the country. Okay, so during 1952 to 2014, education expenditure as percentage of total government expenditure increased from 7.92 to 15.7. Okay, it has increased from 7.92 to 15.7, and as a percentage of GDP has increased from 0.64 to 4.13. Okay, so throughout this period, the increase in education expenditure has been uniform and it was not uniform, and there was irregular rise and fall. Okay, but to this, when we add this private expenditure, then the total of educational expenditure should be much higher. Okay, so you all know elementary education takes a major share of total educational expenditure, and the share of higher or tertiary education, that is institution of higher learning like colleges, then polytechnic and university, is the least. Okay, in 2014-2015, the percentage or the per capita public expenditure on elementary education differs considerably across states, from as higher as rupees 34,651 in Himachal Pradesh to as low as rupees 4,088 in Bihar. Okay, so this leads to difference in educational opportunity and attainment across the state. Okay, so see, you can see the table here. So this table shows the educational attainment in India. Okay, so when you see this, you can see adult literacy rate, percent of people aged 15 plus. Okay, male and female, it is given here 61.9, 37.9 in 1990. In 2000 it was 68.4 and 45.4. Then in 2015, 81 and 60. This is how the literacy rate has increased. Okay, and next, primary completion rate. Okay, primary completion rate, male and female also, it has increased. Before it was 78, then 85, then 94. And in female it is 61, 69 and 99. Okay, and even the youth literacy rate has increased. Male 76.6, in 2000 it was 79.7, and in 2015 92. And female in 1990 it was 54.2, then 64.8 in 2000, and in 2015 87. Okay. Okay. So generally this educational achievements in a country has indicates in terms of, okay, this educational achievement in India is indicated in terms of adult literacy level, then primary educational completion rate and youth literacy rate. Can you all see this? Okay, here it is given. Okay, educational achievements in a country are indicated in three ways, that is adult literacy rate, then primary completion rate and youth literacy rate. Okay, so these statistics for the last 2 decades are given. That is what I have told you in this table. Okay, now education for all, still a distant dream. That is the next part. Okay, though literacy rate for both this adult as well as youth have increased, still the absolute number of illiteracy in India is much as India's population was at the time of independence. So even though this literacy rate has increased for both adult and youth, but still there is illiteracy in India as much as India's population was at the time of independence. Okay, so in 1950, when the Constitution of India was passed by the Constituent Assembly, it was noted in the directive principle of the Constitution that the government should provide free and compulsory education for all children up to the age of 14 years within 10 years from the commencement of Constitution. Okay, but we have still not achieved this. Okay, if we would have done now this, we would have achieved 10% literacy by now. Okay, okay, and the difference in literacy rate between male and female are narrowing significantly. Okay, significantly in a positive development. In gender equity. Still, the need to promote education for women in India is imminent for various reasons, such as improving economic independence and social status of women, and also becoming women education. It's also because of it's because of women education makes a favorable impact on fertility rate and health care of women and children. Okay, so therefore we cannot compare about the upward movement in the literacy rate, and we have miles to go in achieving 10% adult literacy. Okay. Okay, in conclusion, what we can say is the economic and social benefit of human capital formation and human development are well known. The union and state government in India has been taking substantial financial outlet for development of education and health services. Okay, that is in the field of education and health sector. The spread of education and health services across different sectors of society should be ensured so as to simultaneously attain economic growth and equity. Okay, so India has a rich stock of scientific and technical manpower in the world. So the need of the house is to be better in qualitative and provide such conditions so that they are utilized in our own country. Okay, so the social and economic and social benefits of human capital formation and human development rates has to be considered. Okay. Okay, Jazakallah khairan. This is all about this chapter. Okay, with this we complete chapter number 5. Inshallah, next chapter, next class we will start with statistics. That is the next book. Okay. we will start that chapter. Okay, then we will inshallah complete this book. Inshallah. Jazakallah khairan.